Welcome to Heart Failure Minutes. I'm Dr. Milica Vukićević. Today we focus on hypertrophic cardiomyopathy, a condition long defined by morphology but now increasingly understood through the lens of genetics, molecular mechanisms, and targeted therapy. What was once managed largely with symptom control is now entering an era where we can intervene directly in the biology of disease. To guide us through this transformation, today I'm joined by Dr. Neal Lakdawala,
Thank you.
Director of Clinical Genetics at Brigham and Women's Hospital, campus of the Mass General Brigham, whose work has helped reshape how we think about inherited cardiomyopathies. Dr. Neal, hypertrophic cardiomyopathy is often missed or diagnosed very late. What are the key clinical red flags that should raise suspicion in everyday practice?
So if you're approaching this from the level of a primary care provider, you're looking at typical cardiomyopathy symptoms, heart failure symptoms of heart failure, so dyspnea on exertion, angina, effort intolerance. We get worried with syncope. In the cardiomyopathy or the general cardiology practice, patients are recognized as having left ventricular hypertrophy, and then the role of the diagnostician is to parse hypertrophic cardiomyopathy from other causes of LVH, like acquired LVH related to hypertension or valvular disease, for instance.
Thank you very much. Our understanding of hypertrophic cardiomyopathy genetics has evolved considerably. How should we think today about gene-positive versus gene-negative disease?
So we're over 30 years from the first discovery of the genetic cause of hypertrophic cardiomyopathy. So John and Cricket Seidman in the late 80s identified variants in the sarcomere genes as the cause of hypertrophic cardiomyopathy. And while we've come a long way in understanding how those variants cause disease, we haven't added too much to the underlying genetic causes beyond sarcomeric variants. And what we have learned, though, is that patients who are sarcomere positive HCM cases, on average, have more adverse events. They have more end-stage heart failure, they have more sudden death, they present earlier in life. At the level of an individual patient, though, we're not still ready to use those genetic test results to make decisions around things like, should I use a medicine to manage this person's heart failure symptoms? Should I consider a defibrillator to prevent sudden death? Those are still made largely on the basis of clinical factors. I think we're going to get there as we move to an era of targeted therapies, though.
Perhaps the most exciting development has been the emergence of Myosin inhibitors. How are these therapies changing the field, and what lies ahead?
So we have a bespoke medication that powerfully addresses the underlying pathophysiology of hypertrophic cardiomyopathy, which is hypercontractility. And in drugs that were developed to treat HCM, we now have an option to manage hypercontractility-related outflow tract obstruction. And so cardiac myosin inhibitors, now multiple cardiac myosin inhibitors, mavacamten and aficamten, have shown marked improvements in symptoms associated with marked reduction in LV outflow tract obstruction, with corresponding improvements in exercise capacity, improvements in cardiac biomarkers, and even some degree of reverse remodeling. We haven't found those drugs, however, to be a true modifier of the natural history of disease, as best we can tell today. And it's worth noting that it doesn't matter if you have a sarcomere gene variant or not. If you have outflow tract obstruction from HCM, cardiac myosin inhibitors will benefit.
Thank you very much for these answers. Hypertrophic cardiomyopathy is not longer just a disease of thickened walls. It is a disorder of sarcomeric biology, genetic architecture, and now targeted intervention. As we refine our ability to detect, classify, and treat hypertrophic cardiomyopathy, we are witnessing actually a shift from reactive care to mechanism-driven therapy with the promise of altering the natural history of disease. This is Dr. Milica Vukićević and Heart Failure Minutes. I'm signing off for now. Until next time.